Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive. Smooth 98.1, love music, love life. This is a Smooth Health on the Drive brought to you by Evercare Hospital, Lekki. Now, recently in Nigeria, unfortunately, the country has seen a rise in morbidity and mortality, and this has been due to so many reasons, from insurgency to bomb blasts, road traffic crashes, armed robbery, collapsed buildings, floods, disease, epidemics. It's a very long list. And of course, there have also been the non-violent emergencies like cardiac arrest, strokes and sudden death, ectopic pregnancies, domestic accidents, and so many more. Now, due to these incidents, the emergency medical service is imperative and integral to reducing morbidity and mortality. And it's also very key to ensuring that prompt emergency response to any type of incident is given. So today on the show, we're talking about the vital role of emergency medical service in overall patient care. And we have a very special guest joining us to have this conversation, Bright Amenaghawon. Okay, I got that right, yes. Yeah, okay, so Bright Amenaghawon is a trained paramedic. He's got many years of experience in pre-hospital, hospital, and even academy settings. Currently, he is a paramedic supervisor at Evercare Hospital, Lekki, and a paramedic instructor at the School of Paramedic Training at the University of Benin Teaching Hospital. Bright is a member of the Association of Emergency Medical Technologist Paramedics. He's got different professional certificates, which of course help him do his job. FIFA diploma in football medicine, a leadership academy certificate, a basic life support certificate, and so many others. Welcome, Bright.
Yeah, thank you so much.
Awesome. Right. As always, you're welcome to be a part of the conversation. If you have any questions or any comments for Bright, you can, of course, send them to us via WhatsApp. The number is 0809 444 0981. You can also give us a ring. The phone number is 01 44 89981. Okay, Bright, let's start with the basics. What is emergency medical service?
All right, thank you so much for the question. Emergency medical service, for short EMS, is you can also refer it to as ambulance service or paramedic service. It's a network of personnel, equipment, and resources which aim at delivery, care, and transportation of patients in the pre-hospital setting to the hospital setting. So basically, you have the ambulance service dealing with patients before they arrive at the hospital. So now you cannot talk about emergency medical service system and not talk about the components which include the provider and informed public, where you have people that are at home or the people that needs this service, they call him to get all of this service. Then you also talk about the agency, like organizations that are involved in the day-to-day activities or running of the system. It includes the private sectors and the public sectors and the government. Then it includes communication, which is a very important part of the system, where you have radio communication, your network providers, where they are able to communicate with themselves in the system and also communicate with the receiving facility. Then you have a highly trained professionals who are expert in what they do. They know the in and out of the system and are able to make some critical decision that affects the patient when it comes to the pre-hospital care environment. Then you have your hospitals, which are part of the component. The hospitals, different levels of hospitals, like the primary healthcare center, the secondary and the tertiary healthcare center. So you have all of these components in the emergency medical service system. So in a nutshell, it's a network which the aim is to provide quality care to the patient before they get to the hospital.
Right. Okay. So it's sort of like first aid.
First aid is part of it. I would like to categorize it like the things you do initially before professional help arrive.
Okay.
So you have an informed public who are trained in first aid and emergency services. They're like BLS. That is basic life support. They know that, okay, these are the basic things I can do before the professional arrives. So you can call first aid as part of the emergency medical service system. But when it comes to professional help, it's bigger than that. You see the professional assessing the patient, making diagnosis, and also taking care of the patient and transporting the patient to the hospital.
All right. I have to say, that's a cool hoodie. What's written on your hoodie? I can say emergency medical technician.
Yes.
Proudly wearing what you do.
Yeah. So,
all right. So, Bright, who exactly is an emergency medical provider? Are there certain qualifications that they have to get before they can actually fit into this role?
Yes. Like you mentioned earlier, you saw something I was wearing. So it's called emergency medical technician. There are different levels to it. Now we have I'll make it short, like EMT for emergency medical technician. We have the EMT basic, which they actually deal with light stuff. They don't give drugs. They don't administer fluid, but they know the in and out of the process. So they are the lowest level in the pre-hospital. Then we have the EMT intermediate, which is between the paramedic and the basic. Then you have the emergency medical technician paramedic, who is the highest level of provider in the pre-hospital care. This provider is well versed in giving, assessing patients, giving advanced life support care to patients, and making transport decision for the patient. So these are the different levels of provider in the emergency medical service system.
All right. So for the first level that you listed, you said they can't, administer any fluids or anything. So what exactly do they do? Do they try to just make the person comfortable?
They go to scene. They respond. There are different level of managing patients. Sometimes a patient might just require a maneuver, can require basic use of adjuvant like OPA, MPA. So those basic things, they are well informed because of the level of training they have gotten. Yeah. So if they want to do more than that, they have to get a proper training that will expand their scope of practice
and take them to the higher level.
Yeah, to take them to a higher level. So currently we're having in Nigeria, we're having paramedics training all over the country. So basically the effort is to minimize these different variation and make sure that we have a uniform system of responding to patients.
All right. Bright, I'm also curious about this. What exactly is the role of EMS in medicine and patient care, particularly here in Nigeria?
Okay. Now, we are very familiar with the hospital setting where you have the doctors and the nurses and they provide care. You have other health professionals in the hospital providing care. Now, before a patient gets to the hospital, they are supposed to receive some level of care. They are supposed to get treatment en route to the hospital. That's where EMS comes in. So these providers are actually, these settings actually geared towards providing care before a patient arrives at the hospital. So you can call it in a nutshell pre-hospital care.
pre-hospital care.
Yeah.
All right. We're speaking with Bright Amenaghawon. He is a trained paramedic with years of experience in pre-hospital, hospital, and academy settings. And we're speaking about the vital role of emergency medical service in overall patient care. Here in Nigeria, a lot of people do believe that these services are not readily available. Are they there, but we just don't know about them?
The services is actually new. Okay, like the University of Benin Teaching Hospital, when they started in 2009 in the whole of West Africa, they were the only school providing the services to train students to become a paramedic. So
Wow.
it's actually new in the system. So you have the new set of because the curriculum was reviewed by the Education Board, and it's now a 5-year thing, training, where a student gets 2 years training, go for internship, and 2 years training. So making everything about 5 years.
So this has just been something that's been ongoing for just 12 years in West Africa.
Yes, in West Africa. So other schools we have recorded a situation where other schools are coming up to train more paramedics. So we actually need more of them in the service, because Nigeria is a large place, a very populated place, and the current students or paramedics that are available for everybody is not enough to power what the patient need at this point. So
we'll take a quick break, and when we return, we'll continue the conversation with Bright Amenaghawon. And of course, if you've got any messages or any questions, comments, we'd love to hear them as well. This is Smooth Health on the Drive.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Smooth 98.1. It's 5:31 p.m. This is Smooth Health on the Drive, brought to you by Evercare. I'm speaking with Bright Amenaghawon. He is a trained paramedic. He's got years of experience, and we're focusing on the role of emergency medical service in overall patient care. If you've got any questions or any comments, please send them to us via WhatsApp 0809 444 0981. You can also give us a ring. The telephone number is 01 89981. And Bryce, I want to ask, what are the different types of services that are available to Nigerians generally?
Okay, so we have for the national level, we have NEMA, the short form for National Emergency Medical National Emergency National Emergency Management Agency. Sorry, I was trying to. It's confusing me with the other organization. So NEMA focus on the national level. Then we also have NEMSAS, which is in charge of the ambulance system in Nigeria. Then for Lagos, we have LASEMA, Lagos State Emergency Management Agency. Then we also have LASAMBUS, which is Lagos State Ambulance Service. Then for the private sector and Evercare, where I come from, we have the ambulance service, which can function has an EMS service in its own capacity. So we deliver quality pre-hospital care to patients.
Right. So all these services are available at Evercare.
Yeah.
Okay. So could you tell us about the importance of EMS when it actually comes to the care of a patient?
So one of the important is that you have a particular you have a particular situation where the patient death, the condition or the disease in the patient is not supposed to result to death. So where the EMS comes into place is that it helps you to give professional care to this patient to avoid preventable death. Then you have a situation like preventable disabilities, where maybe somebody had an accident on scene, the bystander is trying to help the person. The condition of the patient was actually partial. Maybe the patient had spinal injury that is partial. So people trying to help, they bundle those patients into the vehicle and complete the injury for the patient. So usually, if it's at the spine, you notice that the patient might not be able to move the leg or the arm, which is paraplegia or quadriplegia. Then in some instances, it can also lead to respiratory arrest. So some of this negative impact, when the EMS system comes into place, you have a situation where you get professional care for that patient, and the injuries are taken into consideration when moving the patient to the hospital. You don't have a situation where you move the patient anyhow. So when you're moving the patient to the hospital, you do what is called a C-spine immobilization, where you immobilize the C-spine. If there's a fracture, you try and immobilize the fracture before moving the patient to the hospital. This prevents further complication and disability in the future.
So basically, if there's been maybe a sort of accident, it's much better for people to just wait for the professionals to arrive.
In an ideal setting, that's how it's supposed to be. But we know in Nigeria, usually everybody wants to help. So you see them crowding the patient and moving the patient anyhow. But in an ideal setting, what you're supposed to do is to call the emergency service number, or you call an ambulance, where the ambulance comes, respond to that particular patient. They know what best for the patient, was the best approach to that patient. Then they would treat the patient and move the patient to the hospital.
All right. In the course of your work, I can imagine that you've probably seen some scenes that are quite graphic, and you've had to deal with some less than ideal situations. Can you just share maybe a few of the experiences that you've been through?
Okay. So I was called for this particular around in the evening time. I was dispatched to a scene at a patient's house where the relative reported that the patient fell while taking a bath. So on arrival, I had to take more history from the patient, and I had to also make sure that it's the trauma is not as a result of a medical case. I have to distinguish if it's a medical case or if it's a trauma case, because sometimes if a patient fall, there might be a situation where the fall might be as a result of low sugar in the blood. So I did my sugar level test and asked for the patient history. So I later found out that it was just as a result of old age, and the patients actually need people to do activity. So afterwards, I immobilized the fractured limb, then moved the patient to the hospital. So that's one instance where you can actually prevent injury or further injury to the patient. Now, another instance is where I had to attend to a case where the patient, the relative called in that, okay, I cannot wake up my husband. So on arrival, we did all the physical examination, and when we checked the sugar level, the sugar level was very low. So we had to decide to give a glucose infusion and it was very dramatic because somebody that was not responding to you, when the relatives saw all of a sudden after our treatment, they are not responding, and it was very amazed and it was hopeful. We treated the patient and moved the patient to the hospital. And then another one, when I was working in Lasema Response Unit, where I went to attend to a road traffic accident involving a trailer. It was two patients that was trapped in the trailer. So the rescue team came to open the trailer up because the patients were trapped. So in a setting where you don't have EMS or ambulance system, that patient is supposed to die. That's a fact, because the patient was trapped there for hours.
Wow.
But because we came there as professionals, we already know what's going on. After the rescue team set the patient free, we were able to extricate the patient from the truck, and we transported the patient. We controlled bleeding, we gave fluid, we transported the patient to the best hospital, the trauma center, where the patient will receive the best care. And I was very happy to see the patient the next day, and the patient was recovering fine. So those are some of the instances that life scenarios that I've seen. And one other one my friend was talking to me about the other day was that she took delivery. She was on duty and she received a distress call where a woman was in labor. So on arrival, the patient was already crowning. So the head of the patient, the baby was already engaged. So she took delivery because we were trained on how to take delivery. She took delivery, and the baby and the mother was okay afterwards. They transported them to the hospital. So some of those scenarios are life scenarios of what has happened in Nigeria.
So these are very positive outcomes. So I guess, it's a good one.
Yeah, it
when
is.
everyone is fine at the end of the day.
Yeah.
Right. And still speaking about the place or the role of emergency medical service when it comes to the care of the patients, are there tips that you can give out to people listening just in case, they might not have that access immediately, or they're trying to get someone comfortable? Are there any tips that you can give out?
Yeah, the first tip I will give out is to get the training. Most of us, I know in the country, we are trying to work with things the way things are, but everybody, even if you are working or you're in school, you're supposed to get at least a BLS training, a basic life support training, and a first aid training. All of this training will prepare you for instances where you will need those skills for emergency response. So you'll be able to know that, okay, I will call for help. Then before help arrives, I will know that, okay, I have to do this and this for my relative or the person I'm trying to help before professional help comes. So one of the tips is that I want you guys to look out for places where you can get this training. Although we are running an in-house training in Evercare Hospital, and soon it's going to be made open to the public. So one of the tips is that know your local emergency number. Like for Nigeria is 112, Lagos 767, and for Evercare is 017K. So you can call in, you prepare, you keep all this information handy. So when the time comes, you can actually get someone to ring. And in Evercare, we are very certain that we are going to respond to you in no time.
All right, Bright. It's been a very interesting conversation. How can listeners contact you at Evercare Hospital?
So, for you to contact us, you just have to call our customer care agent. There will be somebody there to receive your call, and you just dial this number 08139850110, or you contact us at info@evercare.ng. You contact our email info@evercare.ng. Or you can visit our website at www.evercare.ng.
All right. Well, thank you very much, Bright. Bright Amenaghawon is a paramedic, and he's got years of experience in pre-hospital, hospital, and academy settings. He's a paramedic supervisor at Evercare Hospital, Lekki, and also an instructor at the School of Paramedic Training at the University of Benin Teaching Hospital. Well, thank you very much, Bright.
Yeah, thank you for having me.
Thank you. And that's it for Smooth Health on the Drive this Thursday on Smooth 98.1. Do stay tuned. There's a lot more to come on the Smooth Drive.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.